What should I do after an osteoporosis fracture risk assessment? After you have undergone an osteoporosis fracture risk assessment, it is important to understand your individual risk level. This understanding will help you work with your healthcare provider to create a personalized management plan. This plan aims to reduce your fracture risk and improve your bone health. First, review your risk assessment results with your healthcare provider. They will interpret the findings, which may involve tools like the Fracture Risk Assessment Tool or other calculators. These tools estimate your 10-year probability of fractures based on your bone mineral density and clinical risk factors. This assessment will categorize you into low, moderate, or high fracture risk groups. Next, discuss lifestyle modifications that can benefit your bone health. Regardless of your risk level, making changes can be essential. Engage in regular weight-bearing and muscle-strengthening exercises. These activities can help improve your bone strength and balance. Ensure you are getting enough calcium and vitamin D through your diet or supplements, as advised by your healthcare provider. It is also important to avoid smoking and limit alcohol consumption, as both can negatively affect your bone health. Implementing fall prevention strategies at home and in your daily activities can also help reduce the risk of trauma. If you have not already done so, your healthcare provider may recommend further diagnostic testing. A dual-energy X-ray absorptiometry scan can measure your bone mineral density. This is especially important if your risk assessment indicates a moderate or high risk. However, routine screening without risk factors is generally not recommended. Evaluate the need for medication, particularly if you are at high risk for fractures. This includes individuals with prior hip or vertebral fractures, very low bone mineral density, or a high calculated fracture probability. If medication is necessary, common first-line treatments include bisphosphonates, which have been shown to reduce fracture risk. Your treatment decisions will be based on a combination of your bone mineral density, fracture history, and overall risk profile. Finally, plan for ongoing monitoring of your bone health. Osteoporosis management is a long-term process. Your healthcare provider will schedule periodic follow-ups to monitor your bone health, the effectiveness of your treatment, and your adherence to the management plan. Adjustments may be made as needed. Remember, osteoporosis and fracture risk can vary widely among individuals. Therefore, personalized evaluation and management are critical. Always consult your healthcare provider for recommendations tailored to your specific health status and risk factors. By taking these steps, you can effectively manage osteoporosis and reduce your fracture risk.